Okay, welcome back to part 2 of critical appraisal of the literature. Okay, jumping right back into it, let's talk a little bit about methods, and particularly subjects. When looking at a study, look to see if the subjects are adequately described. Is the method of subject selection or assignment clear? Is the control group established that are identical except for their characteristics under study? And is sample bias avoided? When the investigator unintentionally introduces factors into the selection of the study population that predetermines the outcome of the study, this is called selection bias. Prevention requires identifying possible interfering variables, then ensuring that their uncontrolled effects will not favor one treatment or another. Okay, here's an example of a selection bias. An investigation was conducted to compare the contraceptive failure rate of intrauterine devices versus that of birth control pills. Previous studies had shown that the greatest single factor in IUD failure was the high rate of early expulsion, while most oral contraceptive failures occurred when women did not take the pills as prescribed. The authors selected 10,000 women with IUDs in place for at least 1 year and 10,000 pill users. They reported a contraceptive failure rate of 8 per 100 among pill users and 5 per 100 among IUD users. The authors therefore concluded that the IUD has a lower failure rate than birth control pills. Could selection bias have contributed to the result? So think about that example. Were the IUD users chosen for the study representative of all IUD users? What was their educational level, their socioeconomic level, their age, their medical status and history, such as history of abortion, miscarriage, fertility? In other words, how similar were the two groups that were studied? A little bit more about method, particularly design method. Is there sufficient detail or reference for replication of the study? Was the intervention appropriate for answering the research question? And was the population size appropriate for the study? And what about method instrumentation? Was the equipment described or illustrated? The data collection instruments described? Were the operational definitions clear, and were the personnel also described? Also in the method category is procedures. So the author should describe steps the subjects go through and the time required. Should be descriptions about the instructions given to subjects, and there should be a description about who collected the data and evidence of patient protection, usually done by a consent form. And of course, data analysis. Was the data analysis appropriate and adequate for types of study and data collected? Were the variables accounted for? Was there information or reference given to understand less common analytical statistics? Was there acceptable probability levels established, and were observation techniques clearly described? Okay, let's look at an observation example. A study was conducted to determine the relationship between smoking and coronary artery disease. 1,000 male smokers ages 50 to 55 and 1,000 non-smokers ages 50 to 55 were followed for 15 years to evaluate the connection between smoking and coronary artery disease. Other risk factors were equally represented amongst both groups. At the end of 15 years, there was no difference between the two groups in the incidence of coronary artery disease. The researchers also found that 60% of the smokers had quit during the 15-year period of time. The conclusion was that there was no relationship between smoking and coronary artery disease. So, regarding that example, was the observation flawed? Which factor was not included in the observation? And what did the researchers know that they ignored or considered insignificant? Okay, let's talk a little bit about results. Make sure that the author confirms or disproves the hypothesis, that the relevant critical values and their probability levels are included, that findings pertinent to the problem are there, and that data and figures correctly are displayed and agree with the text. And here's an important thing. Make sure that the text is not repeated in tables. Okay, now take a minute and look at the conclusion. make sure that there are brief paragraphs on key findings and implications there at the conclusion. All right, let me do a quick summary if we're looking at critical analysis of the literature. Always look at the overall study. Be sure to critically study the methods used by the researcher for selection, testing, analysis, and conclusion. Who was included? Did they represent the population accurately? And was the sample adequate? Is the article clearly written and complete? And lastly, could you duplicate the study? If you do this, you'll be able to figure out a good study from a bad study. Okay, there you have it. So thanks for listening to these two mini lectures on critical appraisal of the literature. I hope it's been worth your while, and I'll see you down the road.